In the future world, patients are not allowed to speak when seeing a doctor, because once they wear a sensor, the doctor can accurately feel the location of the patient's pain. A scientist gently slid across the woman's left index finger. The doctor, wearing the receiver, immediately felt the sharp pain in the finger. But what he received was only the sensation. His body would not actually be harmed. Dawson, as a pioneer, volunteered to have this sensor implanted, and the sensor was directly connected to his brain. Once implanted, it could never be removed. From then on, those critically ill patients too pained to speak only needed to wear the sensor to transfer the pain in their bodies and the location of their injuries directly into Dawson's brain. The hospital's surgery success rate therefore rose to 99%. But as the patient's conditions worsened, the pain Dawson endured grew stronger and stronger, even the agony of late-stage cancer. He managed to grit his teeth and endure. One day, a child was brought to the hospital. Other doctors suspected appendicitis, but Dawson had already felt appendicitis dozens of times. He knew this was not the same sensation. After carefully sensing, he discovered a tumor inside the child's body, and thus saved a life no one else could save. Everything seemed to be going well, until that day. A politician racked with pain was sent into the clinic. All the doctors failed to determine the cause. The heavy responsibility had to fall on Dawson. Even he, who had felt every kind of pain, was nearly tormented into fainting by this agony. At the critical moment, the politician's heartbeat suddenly stopped. The feeling of death instantly flooded into Dawson's brain. He fell unconscious for a full 5 minutes before waking. After examination, the doctors found his body had no abnormalities. But from that day on, Dawson's behavior became stranger and stranger. The time he spent feeling patients' pain grew longer each time. Now he seemed to begin enjoying the pleasure of pain. But ordinary pain was no longer enough to satisfy him. He stayed in the clinic all the time, waiting for new critical patients to arrive. Once someone was brought in, he would pounce on them like spotting a feast, and put the sensor on the patient. One day, an old man fainted from a heart attack. The extreme agony made Dawson intoxicated, until the old man was on the brink of death. He still did not reveal his diagnosis. By the time others noticed something was wrong and pulled him away, the old man had already lost his breath, and in Dawson's eyes, there was not a trace of regret, only the fury of being deprived of his pleasure. Afterwards, Dawson was removed from his position and placed at home to rest. But bored at home, he could no longer resist. He put on a hooded coat and wandered the streets to begin looking for a new target.